Hi, I'm Russell Vinik. I'm Medical Director of GBS Benefits. Today, I'd like to talk to you about statins and cholesterol and the role of statins in reducing cardiovascular events. So, items I'd like to cover today. Number one, the role of cholesterol in cardiovascular disease, the benefits of statins, the risks and side effects, and then finally, who should be treated. So first, let's talk about the role of cholesterol in cardiovascular disease, or you'll see this acronym ASCVD, which stands for atherosclerotic cardiovascular disease. So in essence, what that is the buildup of plaques, mostly containing cholesterol, in the arteries, which can often break off and cause heart attacks or strokes. So there's two main types of cholesterol: HDL, which is the good cholesterol; LDL is the bad cholesterol. In general, people with an elevated LDL cholesterol have 2 to 4 times higher risk of dying from cardiovascular disease than people with normal cholesterol. For every 40 points above normal, increases the risk of a heart attack or stroke by about 30%. So there's several ways to reduce your cholesterol. Number one, diet. The Mediterranean diet can reduce LDL by about 15%. Now, a caveat is that comes from controlled studies, which is not necessarily reflecting the real world. In the real world, when your doctor tells you to go on a diet to reduce your cholesterol, what we see is around a 5%, maybe a 10% reduction in LDL. Exercise will reduce your LDL a little bit, but more importantly, it'll increase the good cholesterol, HDL. Omega fatty acids, which is the acids that are found in fish oil, they can reduce triglycerides, which is one type of fatty acid. But what we have not seen is any good data showing that it can truly reduce your risk of heart attack or stroke. Maybe a small amount, but the studies are still a bit controversial. And then finally, medications. We're going to focus today on statins because those have been proven to be the most effective. But there certainly are other medications that can be effective or even added on to statins for cholesterol reduction. So statins, there's two big groups. What we talk about is the high intensity statins. Those have generally been shown to reduce cholesterol or LDL cholesterol by about 50%. The two brand names you'll know of the most are Crestor and Lipitor. They go by the generics atorvastatin and rosuvastatin. And then the lower intensity statins, which are a bit older, recognize these are all generics. They're pretty inexpensive, but Zocor or simvastatin, Pravachol or Pravastatin reduces cholesterol by about 30%. So here's a summary looking at over 20 different trials with over 100,000 people studied. And just to summarize this, it's a busy slide, but what you see is statins overall reduce coronary events, whether it be death, heart attack, stroke, need for revascularization, by about 20% for every 40-point reduction we get in LDL cholesterol. Now, this study is showing that as we have better and even higher reductions in cholesterol, we see even better improvement and reduction in cardiovascular events. So there certainly are risks to statins. Myalgias is the medical term for muscle soreness. About 30% of people taking statins report myalgias. A lot of them stop taking the statin because of myalgias. But here's the difficult part, is we all have myalgias, and we often might attribute them to the statin because we know that's a side effect of statins. And so the hard part is, what is the true incidence of myalgia due to statins? When we look at placebo-controlled trials, what we see is the difference in myalgias between statin and placebo runs generally about 1 to 3%, maybe as high as 5%, but really not nearly what we see in people discontinuing. Once again, myalgias are common, and they're not always due to statins. In fact, the vast majority of time, if you have a myalgia and are on a statin, it is not because of the statin. Now, there are some serious side effects related to statins. One is called rhabdomyolysis, which is an inflammatory condition that causes breakdown of muscles. Pretty rare, 1 in 20,000 people per year, generally happens within the first year of treatment, but this is why there is a warning. If you do have muscle pain, you should report it to your doctor. Another side effect, elevated liver function tests. Serious elevation in the liver function test happens about 1% of people taking statins, generally within the first 3 months. A lot of times you don't even have to stop taking the statin. It'll go down on its own. Sometimes this does require changing of statins or reducing doses, but this is why they are typically monitored at least about 3 months after starting therapy with a statin. So, who should be treated with statins? This is a very oversimplification that I would encourage you to talk to your provider. Certainly anybody who has established cardiovascular disease, they've had a heart attack or stroke, they would benefit significantly from a statin. Diabetics, if their LDL is greater than 70 and they're over age 40 years old, should be treated with a statin to get their LDL down below 70. In non-diabetics, this is where it gets a little bit more complicated. The most recent guidelines from 2019 recommend if your 10-year risk of atherosclerotic heart disease events is greater than 7.5%, then you're generally recommended to start a statin. So how do I know if my 10-year risk of having an event is high? Well, it's pretty easy. If you go online into any search engine and type in ASCVD calculator, it will get you to one of many calculators. This is the one from the American College of Cardiology. And you can see in this case, I put in somebody who's got quite a few risk factors. A 50-year-old with high blood pressure, smoker, has high cholesterol, and you can see his risk of having an event is 19% over the next 10 years. So certainly he would benefit from a statin. What's pretty neat about this calculator is it also shows you the effect of different interventions. So if we just started a statin, this person's risk would decrease from 19 to 14%. If we checked all of these boxes and he quit smoking, got started on blood pressure medicine, and also started taking aspirin, his risk could be reduced significantly lower to about 6%. So, final thoughts, reducing cholesterol significantly reduces the risk of cardiovascular events, but every treatment has risks. The benefits of statins overall far outweigh the risk in people at high risk of having cardiovascular events. Finally, talk to your provider. Every plan needs to be individualized. There are a lot of nuances, a lot of personal decisions, and this is where a discussion between you and your doctor could very much help. Again, my name is Russell Vinik with GBS Benefits. I appreciate you joining me and look forward to speaking with you again next time. Take care.